Um, Anyways, a little bit of personal history was that myself, back in 1996, I was looking, actually back then, even though I treated a lot of cancer cases before 1996, prior to 1996, I took a view of treating cancer as though I was treating cancer. When a cancer patient came in, I forgot that there was a person there, even though I did a lot of alternative treatment. I was attacking the cancer. And it was back in 1996 that I found some of my own markers were high. In fact, there's a test called AMAS, anti-malignant antibody assay, and just for fun, I thought I sent a sample of my own blood in, and the result came back very high. It was frightening. And then right away I said, gosh, physician heal myself. I've never really given myself a thorough check. Immediately I put myself through all the testing, so I put my patients through, and I had a parameter called LDH that was in the thousands, and usually it should only be in the hundreds. And I said, good gracious, I better look at myself a little bit more carefully. And then I realized that I was a little bit tired when, in the middle of a day of the practice, and also had about 2 weeks worth of night sweats. And I knew then night sweat, I thought I was maybe just had too many blankets on, just like any other patient, never took notice. And then I realized that it could have been something what we call B symptoms. B symptoms are signs when your immune system is being overwhelmed. Okay, and B symptoms came from the fact that maybe the B lymphocytes are being overly stressed. All right, and I went for MRI and I found a 1.5 centimeter mass in my own neck. Talk about saving your own neck. And my choice was, of course, to do a needle biopsy and maybe to go on to chemotherapy and retire. And maybe I said, gosh, this is terrible, because I've seen wonderful results of that. The reason why I could go on was because there were some cases that had very good results, including actually one of the pancreatic cancer in Vancouver that I co-worked with this oncologist that had fantastic results, and it was another turning point in my life. So I decided to really change my lifestyle and treating myself, and then I realized there are a lot of other things to work on, including the emotional aspect, the attitude. That was, I learned about Dr. Symington's psychotherapy when I was in Bastille, and I thought, oh, come on, how can you talk someone into getting well? And that's when I realized that having a positive attitude when you have the right mindset is so important in healing. And again, other than learning more about being positive, maintaining a positive attitude, being assertive, taking control, and not being afraid of taking steps forward. And that was when I started not only to empower myself, but also went ahead and empower a lot of my patients to take positive steps. If it's surgery, if we lay everything on the table, that is the right thing to do. Don't regret a single minute and go forward. But make sure that we rationalize everything, look at everything without leaving a single stone unturned, and step forward and try your best to have all of the angles and basics covered. And that is very important in cancer management. And it's really no big deal. We all get cancer one of these days. In fact, another lesson that I learned was that I remember way back when I did a lot of autopsies in Medicine Hat General Hospital, there were at least over half of the corpse that we did that we found signs of cancer, and these people never been diagnosed or known to have cancer. Never in a million years would they have thought of having cancer. Like, amazingly, I also learned from Dr. Block, with his 35 years of oncology experience, I was surprised. He said, you know something, a lot of these women who are diagnosed of ovarian cancer, they don't really have ovarian cancer. A lot of them really have a condition called peritoneal carcinomatosis. In fact, I remember back then, these whole hunk of grape-like nodules that we yank out from these people's peritoneum. And they were hard like a piece of rock. They are like tiny little pebbles. Cancer lumps won't give because the cells are so packed and they're so dense, you know. And these people live comfortably, you know. We learned a lot of things from patients. You know, one lesson to learn was that I have a patient and I'm still treating him, and this patient was known to have colon cancer. And interestingly enough, he never responded to conventional treatment. He never responded to immunological treatment, and yet his tumor marker would be climbing. And it's been 3 years now. His CEA has climbed up to over 3,000. You know something, amazingly, when they repeated the CAT scan finally, only a few months ago, and one of the oncologists that his regular oncologist thought, gosh, I have my hands up, I don't know what to do with you anymore, Randy, and said, why don't you go and see this oncologist who's a little bit more investigative. And this turned out to be an oncologist who is very open-minded and investigative, and yet she is really a specialist in feminine type of cancer, in female cancer. And at first he was a little bit puzzled why he's seeing this gal. And when this oncologist looked at his CT film, he said, you know something, I don't understand this. You're a man, but your CT looked like you have ovarian cancer. Then it dawned on everybody that we're looking in the wrong place. In fact, this fella might not have colon cancer. What he might have is really peritoneum carcinomatosis, which can also happen in men. It dawned on people, oh my goodness, we better do another tumor marker. Guess what? I looked back in his records. Not very good doctor, and I realized that I did do a CA-125 on him by mistake, which is meant to be, you know, a marker of ovarian cancer. And I did not look at it any further because I thought my staff made a mistake, that's all. And it turned out he had a high marker, ovarian cancer. So right away we said, okay, we're going to have to switch. So right away we plunged into very, very intensive immunotherapy instead of trying to kill the cancer, because from what I've learned from all these wonderful people who had a lot of experience with this so-called carcinomatosis is that you cannot kill them. This type of cancer you cannot kill. So there's no point in dropping an atomic bomb. There's no point in going in with machine guns. You have to be nice to them. You have to train them to turn them into differentiated cells instead. You have to try to do something to stop them from spreading, from crawling around the organs. And then we have to really concentrate on beefing up our police force and move in. We have to rely a little bit heavy on our immune system to kill them. And news was only last week, first time ever, I couldn't believe this, his tumor marker dropped by 500.